Hi, my name is Grace Lee, and today I'm going to be talking about cystic fibrosis. Behind me, you can see what cystic fibrosis looks like on the human lungs. Right here is a normal human lung, and here is a lung affected by cystic fibrosis. Cystic fibrosis is caused by the CFTR gene in chromosome 7. Either the CFTR gene is not functioning properly, or there is no CFTR protein. Although there are many forms of treatment, there is no cure according to the Cystic Fibrosis Foundation. The forms of cure include medications to prevent infections, airway clearance to clean up the buildup of mucus, and lung transplants. However, lung transplants are the most effective way since cystic fibrosis patients are bound to die. Lung transplants can help expand their life. Although patients that are not able to obtain a lung transplant must wait out death. There are also other types of medicines like tobramycin and ciprofloxacin and Creon and Kalydeco, which all help fight infections and lessen the pain that these cystic fibrosis patients have to go through. According to the National Jewish Organization, cystic fibrosis has been occurring for centuries, recorded back to the Middle Ages, and describes the salinity of a person's skin. The salinity of a person's skin is a symptom of cystic fibrosis, and according to Medline Plus organization, there are multiple other symptoms as well, including salty skin, multiple infections, and wheezing, coughing, and bad growth in the body, even through good nutrition, as well as the male becomes infertile. In addition to the history of cystic fibrosis in the past was thought to be a curse or some sort of hex. Pathologist Dorothy Anderson made the first description of cystic fibrosis. She originally based it off the cases of malnutrition in children, originally called muscovidiosis. Other facts of cystic fibrosis include that there are more than 2,000 identified mutations of this disease. Therefore, it is very difficult to treat and may be the main reason why there is no cure for cystic fibrosis, mainly because there are so many different types out there. In addition to that, the CFTR gene was discovered in 1989, and 127 CFTR mutations are known to cause cystic fibrosis. Therefore, meaning not all CFTR genes can cause cystic fibrosis. This disease is autosomal recessive, and because of that, for testing, many doctors have tested on babies for x-rays and blood testing. In order to have cystic fibrosis, 2 copies of the cystic fibrosis gene are needed. That is why it is recessive trait. If only one person if only one parent carries a cystic fibrosis gene, that means the baby is then a carrier. Even though cystic fibrosis is something that, even if cystic fibrosis is something that not a lot of people have, it is still very difficult to screen for it. So even if a person may have it, it may be not found until much later in life. This is because not a variety of screening is provided for patients with cystic fibrosis. Therefore, patients must live out the pain of cystic fibrosis without knowing they have cystic fibrosis, not being able to treat it for much longer than they must. More than 70,000 people in the world are diagnosed with cystic fibrosis. And even with this large number of people that have this gene, that have this mutation and disease, there is still no cure, and there is still no progression in this cure. In addition to that, approximately 1,000 people are diagnosed with cystic fibrosis every single year, increasing the number of 70,000 every single year. And the median survival rate is about 40. Therefore, these people will not live to see their grandchildren or their great-grandchildren. The final definition of cystic fibrosis is a life-threatening disorder that causes damage to the lungs and the digestive system.